Hi everybody, I'm Dr. Ejiro Isiorho with Tigard, Oregon Corrective Step Foot Health Center. We have some Hammertoes here. They are flexible, and we have our patient who's numb, and we're actually going to be doing a Flexor Tenotomy on number 2 and number 3. So our patient is good and numb, because believe it or not, this is going to be a pretty quick procedure. Unfortunately, sometimes people get Hammertoes. Hammertoes is what happens when your toes start to curl up. Sometimes they can be flexible, sometimes they can be somewhat flexible, sometimes they can be rigid. This type of procedure works really well on semi-flexible or flexible toes. Unfortunately, rigid Hammertoes do not do well with this Flexor Tenotomy. Unfortunately, real surgery in the OR or ambulatory surgery center or making more blood is usually what's indicated. In this case, we can actually do our procedure with a small needle, just like we're going right here. So I put some tension on the sulcus, and if you hear closely, you may even hear the tendon cut. It sounds like celery. Are you doing okay? Mm-hmm. And I can feel the tendon releasing. And I can feel it getting looser. Wonderful. You can even see that toe sits flatter.
Mm-hmm. Oops, it's bleeding quite a bit.
Yeah, here it is. And now we're going to do number 2. We're just swiping back and forth with our 18 gauge. You can hear it releasing. And that's that. Now you can see the toes do relatively well. You can see how small that incision is. Now we get our dressings ready. Put these medicated dressings. And this is going to be the most important part of the procedure, is splinting the toe in the correct position. So I've already talked to our patient about keeping these dressings clean, dry, and intact. So the first one goes around the toe to keep it nice, the bandage, the foam bandage in place. So again, keeping the bandage and dressing nice and taut. And then this is the most important part of the procedure. So putting the sticky part of the bandage on the toe, removing the second part of the bandage, we're pulling the toe straight and flat. We're reinforcing that the correction of the deformity. So we did that for the first, or number 2 toe. Now let's do it for the number 3 toe. Again, half the sticky portion is available. We put it on the bottom or the distal pulp of the toe, pulling or pressing the joint down, straighten the toe out, remove that sticky part. So the toes sit nice and flat, and you can already see how much longer they are compared to beforehand. Mm-hmm. Our patient has a post-op shoe that they'll be wearing that'll prevent the toe from getting crowding and potentially going back in a bad position. Our patient has instructions. They're going to keep this dressing on for at least 24 hours, 8 hours at the very minimum. And then they're going to remove the dressing. They can shower and clean and do normal activity. The important thing is to strap the toe as was shown in clinic, and that will keep everything nice and happy. And since you are a doll, we'll give you fun color. And that's that. All right. Take care. Until next time, Dr. Isiorho from Corrective Foot Health Center in Tigard, Oregon.